Thank you very much, Right Honorable Speaker, and I thank the Honorable Member for raising the issue, which you had also raised in your communication. Malaria remains a big contributor to the national burden of disease in Uganda. And actually, Uganda contributes it's the third in terms of contributing the burden globally. And although we have had several interventions to address this challenge, it remains real. So what he's raising is real. The studies we have carried out show that the parasite prevalence among Ugandans has substantially declined from 43% in 2009 now to 13%, meaning that the interventions have been working, but usually we experience seasonal surges in infections, especially between the months of May and July, and then September to November. So the Ministry of Health is alive to this fact that there has been a surge in the malaria infections, and our malaria control program, working with the school health program, have mounted a big campaign and response, also targeting schools. But since it's a big issue, I beg that you give me time. I have instructed the team in the Ministry of Health to work 24/7. And tomorrow, when we convene, I come with a comprehensive paper outlining the interventions which we are pursuing, both the school system but also in the country, so that we highlight the way government is responding to this challenge of malaria. So tomorrow, I will be ready in the afternoon to give a comprehensive report to Parliament.
Thank you.
Thank you.
And that would also help to guide the nation, to guide the members of the public.
Absolutely.
Thank you. Thank you. Next item. Procedure, Honorable Sir Kabira. Is it procedure? Sir Kabira, is it procedure?
That's right, Honorable Speaker. Yeah. Under Rule 8, Right Honorable Speaker. Right Honorable Speaker, 3 weeks ago, the leader of opposition raised a matter concerning medical interns. The same was raised last Thursday, and I'm glad the minister is here. He had committed that today he will present a policy by government on the interventions that are undertaken to make sure that our medical interns are catered for. I am glad 2 days ago I saw him in Mbarara General Referral Hospital, where he found 2 medical interns covering the ICU. May it please you to ask the minister to give us the developments from cabinet on the placement of medical interns. Thank you.
Honourable Minister, do you have any update for the House?
Thank you very much, Right Honourable Speaker, and the Honourable Member for raising the issue. Internship, in this sense, means a medical student pursuing a degree in medicine or dental surgery or even pharmacists or nursing, completes the university education, graduates, and then before you are issued a practicing license, you undergo apprenticeship or internship for 1 year under supervision. And it's a practice in the medical profession. So a policy, and the government has been facilitating interns with a modest allowance to enable the interns survive as they do internship, usually done for 1 year. A policy was passed to review the issue of internship, and the cabinet made the following decision. There is a policy which was sponsored by the Ministry of Education and Sports on health training, and it was passed as follows: that internship be considered as part of training, and in that respect, that if you have been government-sponsored, government continues to sponsor you when you are doing internship. And if you have been on private sponsorship, then you continue on private sponsorship during internship. There have been mixed reactions, and I know this matter was raised by the leader of the opposition, and just hold on. Just hold on, I will allow you, but let me first complete this sentence. And the Right Honorable Prime Minister and Her Excellency the Vice President made a commitment, and indeed we are relooking at that policy measure. I am drafting a cabinet paper to take back to cabinet so that we look at that decision again. And I think the concerns are genuine, because internship, much as you are under training, but you are also providing a service. So I want to request Parliament. I want to request Parliament to be patient, because this is a matter which was canvassed in the cabinet. I cannot singularly reverse the position. So you give me time at the earliest. Once cabinet has put me on the agenda, I will present a paper, and then once the decision is taken, I will come back and brief Parliament on the matter.
Thank you. I will allow you only
Excuse me,
one.
Minister.
Honourable Minister, I will allow you only one if you want.
I also want you to clarify on the issue of the...
Honourable Minister, whom did you allow? I just
He allowed
want to
me.
know.
He allowed me. I'm the one who raised it
Please,
the other time.
Honourable, please, that's not how we do. Whom did you allow? No, it's not a matter of grabbing the
I
microphone.
beg that you we allow the two, because I am trained to be very humble to ladies.
Thank you so much.
Maybe
Thank you.
And
As
men
long as
are
they are
known
brief.
for grabbing from women.
as long as they are brief.
Thank you, Right Honourable Speaker, and thank you, Honourable Minister. Honourable Minister, your response where you stated that there has been a cabinet decision that interns be treated like interns be treated like they are on a training. Truly, they are on a training. But Right Honourable Speaker, the clarification I'm seeking from the minister is that sounds like there's a policy shift or change, if I may call it. And I think it would be prudent that you, the minister, comes with that policy shift or change, and we also debate it, perhaps. That is the clarification I'm seeking. Is there a policy shift, or it is just a cabinet decision? But I think it tantamounts to a policy shift.
Thank you so much. Thank you, Honourable Minister. Honourable Minister, I want to bring it to your attention that in the 2024-25 cohort and 2025-2026 cohort, there are some interns who are not paid. These are the clinical officers who are doing the internship. Because this is not the same as their salary, this is just an allowance, but they are around 300. And secondly, the senior house officers. You know, we have a challenge that our doctor to patient ratio is 1 to 25,000, which is far big number compared to the international number of 1 to 1,000 of WHO Health Organization. I need your clarification on that. Thank you.
Honourable Minister.
I think most of these issues, Right Honourable Speaker, will be answered when I bring a comprehensive statement. I have just said that I am preparing a paper for Cabinet to look at that policy decision. And maybe I can add that what is causing this is that initially we had Makerere Medical School being the only university training doctors. But because of the policy on liberalizing tertiary education, tertiary and university education, we now have many universities training doctors, both public and private, and therefore the numbers have grown. So we are discussing this with the Ministry of Education to even look at how we guide the universities on the numbers, how many train for the medical profession, and I will capture all these when I bring the paper. Yes, there are issues of payments